Your feet can provide clues about your overall health and may be the first place to show signs of certain systemic diseases. You can detect everything from diabetes to nutritional deficiencies just by examining the feet, says Jane Anderson, DPM, who serves as the president of the American Association of Women Podiatrists. Understanding what your feet are telling you about your health doesn't necessarily require a medical degree. You simply need to be aware of the key warning signs. If any of these particular signs or symptoms manifest in your feet, it would be advisable to seek a consultation with your physician. Cold feet might mean you have poor circulation, which could be a sign of heart disease. A great way to test that blood flow is good is by using your feet, says podiatrist and podiatric surgeon Dana Canuso, DPM. Squeeze your big toe for a few seconds until it turns white. Once it does, release it and count how long it takes it to pink back up. Your toes regaining blood flow in about 3 seconds is a sign of good circulation, according to Dr. Canuso. Some common symptoms associated with heart disease include chest discomfort or pain, heart palpitations, pain in the neck, jaw, throat, upper abdomen, or back. One of the most common foot signs of kidney disease is swelling, also known as edema. The kidneys help control the amount of fluid in the body. If they aren't functioning properly, fluid can build up, leading to swelling in the feet, ankles, and lower legs. Kidney disease often progresses silently, often causing noticeable symptoms only when the condition is advanced. However, if you're aware of the signs, you might be able to detect a problem early and seek treatment. Here are some other potential symptoms of kidney disease: changes in urination, fatigue and weakness, shortness of breath, muscle cramps, feeling cold all the time, metallic taste in the mouth. Damage to the nail or an illness affecting any part of the body can result in white patches on the nails. If a nail, or a portion of it, detaches from the nail bed, it might turn white, a change potentially attributed to injury, nail infection, or psoriasis. If the nail remains whole but predominantly appears white, this could occasionally signify a more severe health issue such as liver disease, congestive heart failure, or kidney disease. Thick, yellow toenails are commonly the result of a fungal infection. However, such nails can also indicate the presence of an underlying health condition, such as lymphedema, a swelling condition related to the lymphatic system, respiratory issues, psoriasis, or rheumatoid arthritis. Dry, cracked, or flaky skin on the heel or ball of your foot could potentially serve as an indicator of a thyroid issue. The thyroid gland is responsible for producing hormones that regulate metabolic rate, blood pressure, tissue growth, and the functions of the nervous system. Therefore, the presence of dry skin might suggest a thyroid-related concern. Thyroid disorders can have a wide range of symptoms because the thyroid plays a crucial role in your body's metabolism. Symptoms can vary depending on whether the thyroid is overactive, hyperthyroidism, or underactive, hypothyroidism. Hyperthyroidism symptoms may include unintentional weight loss, rapid heartbeat, increased appetite, nervousness, anxiety and irritability, tremor, fatigue, muscle weakness, difficulty sleeping, skin thinning, fine, brittle hair. Hypothyroidism symptoms may include fatigue, increased sensitivity to cold, constipation, dry skin, weight gain, puffy face, hoarseness, muscle weakness. Sores that don't heal, dry skin, or frequent infections can be signs of diabetes. Diabetic neuropathy can also cause a loss of sensation in the feet, making foot injuries more likely. Here are some of the common signs and symptoms of diabetes: frequent urination, increased thirst, extreme hunger, unexplained weight loss, fatigue, blurred vision, tingling, pain, or numbness in the hands or feet. At times, a nail injury or recurrent exposure to petroleum-based solvents can lead to the formation of a concave, spoon-like shape in the nail. Nonetheless, this peculiar shape can also be triggered by an iron deficiency. Iron deficiency is a common nutritional disorder in which the body lacks enough iron to produce hemoglobin, the substance in red blood cells that enables them to carry oxygen. As a result, your body can't get the oxygen it needs. Here are some common signs and symptoms of iron deficiency: fatigue, pale skin or mucous membranes, headaches and dizziness, swelling or soreness of the tongue, or cracks in the side of the mouth, cold hands and feet, frequent infections. Vitamin B3 plays a vital role in maintaining skin health. and a deficiency can lead to a condition called pellagra. A hallmark symptom of pellagra includes skin that is cracked and scaly, which can manifest on various parts of the body, including the heels. An abrupt, intense pain in the foot is a classic sign of a muscle spasm or cramp, which can persist for several minutes. Common triggers include overexertion and muscle fatigue. Other potential causes can be poor circulation, dehydration, or imbalances in the body's levels of potassium, magnesium, calcium, or vitamin D. A feeling of burning in the feet is frequently experienced by individuals with diabetes who have peripheral nerve damage. This sensation can also be brought on by a deficiency in vitamin B, athlete's foot, chronic kidney disease, inadequate circulation in the legs and feet, known as peripheral arterial disease, or an underactive thyroid, hypothyroidism. If you observe any discoloration, specifically black and brown lines beneath a toenail, and don't recall any corresponding injury to your toe, it would be prudent to consult your doctor. Such dark vertical lines under a toenail could potentially indicate the presence of a concealed melanoma. Just like feet, the palms of your hands can also show signs of various health conditions. Your hands speak volumes, especially when something's not working right. Their form, function, and appearance can offer important prognostic and diagnostic clues. Gout can lead to sudden, intense swelling in one or several finger joints. Typically, the kidneys have the ability to filter uric acid from the blood and expel it through urine. However, when an individual generates excessive uric acid, or if the kidneys are not working optimally, uric acid can accumulate in the bloodstream and crystallize. Over an extended period, these crystals can accumulate in the joints, leading to the formation of tophi. There are some other signs that may appear on the hands and nails related to changes in the body due to poor kidney function. Some of these may include changes in the nails, skin color changes, yellow or brown, pruritus, itching all over the body, including the hands. People with diabetes may experience limited joint mobility, which can lead to a condition called prayer sign. When asked to press their palms together in a praying position, they're unable to bring together the phalanges due to stiffness. Vertical ridges are typically a normal sign of aging and are not a cause for concern. However, horizontal ridges, Bowes lines, can be associated with serious conditions such as uncontrolled diabetes and peripheral vascular disease. Palmar erythema, also referred to as liver palms, is a condition characterized by redness on both palms, primarily on the heel of the palm, but it can sometimes spread up to the fingers. This condition is frequently linked with liver diseases, including liver cirrhosis, hemochromatosis, and Wilson disease. Non-uniform white spots or lines on the nail are called leukonychia. Typically results from minor injuries and poses no harm in individuals with good health. However, it can occasionally signify poor health or a lack of certain nutrients. It can be related to infectious diseases, metabolic disorders, systemic illnesses, or specific medications. Some autoimmune conditions, such as rheumatoid arthritis or lupus, can cause joint deformities in the hands or nodules under the skin of the palms. It is crucial to pay close attention to any changes or signs that may appear on the body, as they can be early indicators of underlying health conditions. These signs, whether they manifest on the skin, nails, palms, or elsewhere, can provide valuable clues about your overall health and wellness. Early detection of potential health issues often leads to more effective treatment and a better prognosis. While not all changes are cause for concern, persistent or unusual symptoms should never be ignored. Regular self-examinations and routine health checkups are important for early disease detection. Additionally, maintaining open communication with healthcare providers about any noticeable changes can greatly assist in early diagnosis and timely treatment. Remember, your body often knows when something is off. Listening to it and responding with appropriate medical attention is essential for maintaining optimal health.